been, the goal is to make sure these people feel better when they leave. So how many of you, that's what they taught you in school. Okay, when your patient leaves, they gotta feel better, okay? How many of you have figured out that's not the most important thing, okay? So if your patient, like I told you yesterday, this is how I got started in this. I was seeing patients, they weren't getting better. I got frustrated, so I had to figure out a better way to do it. So it wasn't that they weren't getting better, they weren't feeling better. They felt great when they left, but they'd come back 4 days later and feel the same way they did before the previous visit. I'm going like, well, if I'm really like doing anything that's important, why isn't it better when they come back, okay? So it wasn't that people weren't feeling better, it was that they were feeling better, but they weren't staying better and they weren't functioning any different, so they weren't able to do what they wanted to do, which is what you guys have probably figured out. You've done all the stuff they taught you in school, and your patients feel better for a half an hour, but after 6 visits, they still have the same problem, okay? So our goal isn't for them to feel better. So if I have a patient come in with 8 out of 10 low back pain, my goal isn't to get their low back pain to go away, okay? My goal is watch them move, figure out where they're dysfunctional,